Welcome everyone to today's webinar about Chilmark Research's latest insight report, Capturing Patient Experience, Current Challenges and Future Needs. Before we begin, I also want to highlight the Chilmark research team is united by a core belief that effective employment and use of IT is essential to modernizing care delivery and ultimately improving the patient experience. We monitor trends and developments in the industry with a focus on these technologies that will be transformational to healthcare delivery. We provide comprehensive, objective, high-quality research for busy executives. It's our way to create a more informed, future-ready market of products and customers. Also coming up is our 2018 Convergence Conference. We just opened up a call for speakers. If you or someone you know is participating in a value-based partnership for Convergence with either providers or payers, please, we encourage you to take a look at our agenda and submit a proposal to speak at our conference. We are especially looking for examples of innovative models in New England to be featured in our Convergence in New England symposium. Unlike our last webinars, this presentation will focus on your questions about the market for measuring the patient experience. Answering your questions is Chilmark analyst and report author, Brian Eastwood. Here at Chilmark, Brian's research focuses on patient engagement and experience from hospital inpatient stays to solutions helping people manage their health outside of traditional doctor visits. I should note we are also recording this webinar and will include it in our follow-up email along with Brian's email should you have any further questions. With that, Brian, would you like to tell everyone about your report?
Sure. Good afternoon, everybody. Thank you for joining us this afternoon, this morning, or this evening, depending on where you are joining us from. This report is meant to examine both current and potential use cases for point-of-care survey solutions within a variety of healthcare organizations, ranging from academic medical centers to integrated delivery networks to independent physician associations. Well, we base this research primarily on interviews with leaders in a Director of Patient Experience or Chief Patient Experience Officer role. Here they discussed the scope of the role, their goals for improving the patient experience, which you can see sort of in the slide here, and the goals and the types of patient survey data that they would find valuable for understanding how they're making progress toward achieving those various goals. Just as you can see here, it's a lot of them are related to targets that have been set around, the reimbursement or penalties through CAHPS, ranging also to improve health literacy, to inform more and better decision making among patient audiences, and just building awareness of the type of patient experience that the organization has and what that means for the role of both clinical staff and also administrative staff in trying to provide that more consistent experience. In addition to discussing goals, the leaders we talked about the types of insight from the data that would help them make better business decisions around improving the patient experience. This does range from very high-level business questions such as department staffing levels, care delivery best practices, also down to meal options, room cleanliness, parking, and other factors. We find this research to be fairly valuable because most organizations today aren't really collecting data about the patient experience at the point of care yet, nor are they even doing it sort of shortly after a care episode within a day or two of a doctor visit or a hospitalization. Most organizations wait for patients to fill out and return sort of those retrospective CAHPS or HCAHPS surveys. These are comprehensive, they're also mandatory, but they don't really allow organizations to address poor patient experiences in the moment. When organizations have better data about what is happening to patients while they're in the hospital or around what has just happened in a visit, combined with some better insight about what steps to take to try and improve those experiences, organizations can be better positioned to provide both the care and the services that patients will need before they are discharged or before a visit is concluded. And this has good potential to provide a better, more consistent experience among staff and throughout an organization, while also striving to improve clinical outcomes because it allows care gaps or other concerns that a patient has to be addressed in the moment and not just retrospectively long after they've left the hospital or the doctor's office. So just to sort of have a few sort of takeaways for you to look at here, and this is really looking at both what we learned from the organizations we spoke with and also in profiling some of the vendors who are active in this space, is that really the best surveys at the point of care focus on very both pragmatic, achievable, and clearly defined goals around patient experience. A lot of them do happen to be tied to HCAHPS scores or CAHPS scores or other metrics, as we'll discuss later, or it could be just around specific business drivers that organizations have set to try to improve the patient experience, and they're tying overall business line performance or even individual staff performance to hitting those goals. Open-ended responses also provide a lot of value in that they indicate a very specific scenario that has occurred. It's not just sort of ticking the boxes or rating something that has happened, but it's describing an event, what went well, what went poorly, offering organizations insight into what they might need to do to improve or what is working well, and also helping them understand how to address an individual scenario before something unfortunate might happen. And what will happen with these surveys, whether it's through open-ended or some of the more closed-ended yes/no type questions, is that you can start to see what's happening within both individual business lines and then within the broader organizations. Where are the points where best practices might need to be changed? Where are particular challenges to improving the patient experience not being met? And this also helps to deliver some insight that will allow organizations to start to make those necessary changes. And there's two ways to focus on that, which again is something that some folks talked about when they were submitting questions at registration, is actionable insights both within the moment while a patient is still in the hospital and has raised an issue, and also longer term looking at broader challenges that they're facing about improving the patient experience within a larger business unit or department, identifying needs, bottlenecks, or things that they're doing well. And finally, a lot of, as I noted, a lot of the focus is on HCAHPS and quality and financial metrics, but there's some less specific metrics like, around employee satisfaction and net promoter score that can, bring some insight into the overall experience. With net promoter score, it's simply asking if patients would recommend a facility or a physician based on the experience that they've had. With employee satisfaction, that does involve talking to clinical staff about their experience, but the insight that they can share about something about whether they're feeling burnout, whether they have too much work to do, whether they're not seeing enough patients, that allows you as a leader in that patient experience office to see and identify needs to improve, but also to understand where the patient experience as a whole is facing challenges and how you might be able to direct them. So as Hannah noted, we're not focusing a lot on slides in this presentation. It's really on the questions that folks have been submitting, and also on you'll feel free to ask questions through the console as well. But what we're going to do for the first time is you're actually going to get to see me answer these questions. And I have to say I am glad that I did not wear the same shirt today that is in the photo that was presented in the slides. You guys, I saw that in my closet, but I did not do it. So I'm glad that's the decision I made. So with that, we're gonna take things away and get started on the question and answer session. As noted, we're gonna start with some of the questions that you all submitted when you registered, and feel free to continue asking questions. And as time allows, we'll be able to get them, and feel free to reach out to me after this event to start to get things rolling and continue the conversation.
Thank you, Brian. First up, what are the primary goals of patient experience officers?
So as you know, as we noted on the slide deck, it really does focus back to what are the particular HCAHPS, CAHPS types of metrics that they're looking for. There's a lot of questions within those sets, and typically the leadership will focus on a handful of specific metrics, 2 or 3 or 4 at a time to focus on it, and then kind of drive best practices on a quarter by quarter basis or a year by year basis. They're also looking to provide that more consistent experience, so that if you go to a facility in one part of town or in one city, and then you go to another city, there will be some regional differences, but by and large, the experience is the same from how you're greeted to, how you go about talking about, meals or calling the nursing staff. And finally, a lot of these goals start to focus on operational challenges that they're facing. Where are those bottlenecks? Where are staff feeling overburdened or overwhelmed, and how are they better? How can they better address those challenges and respond and start to, streamline the process and make it more consistent and better for those patients?
What is the most pressing need for healthcare organizations that want to capture patient experience data at the point of care?
So the thing that the leaders expressed most was that they wanted something they could use many times. So something that would be extensible both across different business lines, so from cardiology to radiology to neurology to the emergency department, but also to be extensible across different metrics, so that they have different, if there are different, new numbers or different areas of focus that they have for those different business lines, that they can capture different information, and they're not just capturing the same information all the time in every for every use case, that they're able to get different information depending on what types of patients they're seeing in different scenarios.
What should healthcare organizations be looking for? Oh, sorry. Yeah, when they consider a point of care solution.
So we broke this into kind of 3 areas, and there's kind of 3 sets of considerations. One is around just the overall functionality of a solution. What features are being offered, and in particular, what analytics has been layered on top of that. What can you as an organization do with the data that's collected? Part of it is being able to see it at the point of care and integrate it with the solutions you're using at the point of care, so you can identify problems sort of in the moment. And part of it is also knowing what's been happening over time, and part of it is also being able to get some sentiment analysis, looking at some of those open-ended questions that the patients have been answering, either at the point of care or shortly after that. The second, feeding off the previous question, is something, an extensible platform, and again, that ability to integrate with tools you're already using, whether it's a business intelligence product or an electronic health record or a care management product, so that you can start to see some of that information as you're delivering care. And finally, usability is a consideration, and this is primarily on the side of the patient. For point of care surveys to really work, the surveys need to be fairly short. A few questions, 5, 7 seems to be the typical model, and they have to be very easy to use. You can't cram a lot of information into a small smartphone screen. It's got to be something that's going to have a nice easy flow to it, so that patients are better equipped to actually complete the survey and take it seriously, instead of just kind of scrolling through, flipping through to say, all right, I'm done, I've done it, and we're off with it. So in summary, it's key functionality, it's an extensible platform, and something that's very easy for patients to use.
What are your 1 or 2 most pressing questions related to capturing the patient experience of care?
So I think there's typically 2 considerations. I think one is, what clinical or operational challenges are most important to your organization around patient experience. Part of it is looking at some of those individual, CAP scores and saying, where do we need to improve? It could be non-CAP score related for, an IPA or different types of organizations. And then the second is sort of a question about questions, which is what types of questions will help you measure the progress toward making those changes. You could directly lift from an HCAHPS or a CAHPS survey, or you could ask questions that are related to those measures that point to parts of the patient experience around that, whether it's the communication that patients receive from nurses. It could be the demeanor of physicians. It could be questions around the flow of staff in an ICU or something like that. So it's really knowing what you want to measure and then figuring out how to ask questions about measuring it.
How do you use real-time feedback to create consistent improvements? How do you address concerns quickly and immediately, but also ensure changes and improvement are consistent moving forward?
Yeah, this is a very important kind of consideration, and I think if you're looking to address concerns quickly, a good way to do that is the use of sentiment analysis and integration with clinical systems, as I noted. What this does is this will put that really important feedback in front of clinical staff at the point of care, and something that comes up about, my pain isn't being managed is going to have some more importance than, or we'll go be funneled to a different person and say my TV is not working. And to provide, kind of consistent change moving forward, one way to do that is sort of gather data, gather information about how those staff have been responding to feedback, and use some reports to show how that progress has been made. Show that to the business line leaders, and then move up the chain to the patient experience staff and say, this is how we have been able to start addressing these issues, and this is how we're showing improvement, and this is where we still have some improvement to be made, where you can make the case for additional resources or perhaps kind of shifting goals a little bit.
Will healthcare organizations start asking the patients their experience as a prerequisite to leaving the doctor's office or the hospital? That way they have it at the point of care. Is the focus on inpatient or ambulatory?
I think increasingly this will be a prerequisite, or at least something where it's sort of strongly considered or strongly advised. And I think it's going to happen in a couple different ways that will address both the ambulatory and inpatient markets. For fairly low acuity scenarios, the use of sort of a kiosk will allow to, particularly a small practice or, a department within a hospital that doesn't see, patients in that very high volume setting. So it could be, imaging or, sort of the department that's orthopedics, something where they can, capture that information. It doesn't require a lot of assistance in a way or explanation on the part of clinical staff. And then, sort of for in the inpatient environment, a tablet, obviously one that has been sterilized, where information is gathered during their stay and at discharge, can start to capture that information about what has happened. And there's also an opportunity there to start to integrate that into a more collaborative process, around understanding discharge information and discussing the next steps in care, or providing some educational resources and making it more than just we want to know what kind of what your experience was like, and turning it into, we want to know what your experience was like, but also, this is what's coming next for you, and how we as an organization hope to make that help you understand what's happening.
How can we reach the most vulnerable populations? How can we involve them in improving their experience?
So in the context of what this report looked at in particular, I think the engaging with this particular population at the point of care can actually play a very important role. Instead of reaching out after an episode of care or after a hospitalization, you can better understand the needs of the most neediest of patients while they're receiving care, while you have their attention, while you're able to work with them, and use that also to kind of start thinking about which other members of the care team, physicians, clinicians, or even sort of community organizations could meet some of the complex needs that they have, either in that care episode or afterward, and kind of set them in motion to receive the care they need, instead of just sending them on their way and then making them come back.
What are current gaps in patient staff surveying solutions?
So this is not too dissimilar to a lot of other patient engagement products, where in the sense that a lot of the surveying solutions are sort of still being implemented in stages, at the point of care, where it's focusing on the most pressing need first, and then if it works out, rolled out throughout an organization. Also, the questions themselves aren't necessarily linked to other survey tools or survey needs. Now, this can work in certain ways depending on the type of information you want to collect. But if goals are, if your patient experience improvement goals are directly tied to HCAHPS or CAHPS surveys, and the questions you're asking at the point of care aren't linked to those questions, there can be some disconnect in the data set, and it doesn't always necessarily help you, tie questions to specific objectives that you have. And finally, I think, it's not necessarily a gap in the solution itself, but it's really the challenge of getting the attention of broader leadership, not just in patient experience, but throughout the organization, when, a product is in place to collect information and maybe a bit flawed and maybe a bit retrospective, but nonetheless is doing a job for the organization, in the form of the retrospective surveys.
What is the trend in patient experience from a market perspective?
So as we've touched on this a little bit, and part of it is definitely focusing on improvements that are more directly tied to business objectives, and those tend to be in turn tied to either federal regulations or requirements. It could be around readmission reduction or HCAHPS scores, or other metrics about patient experience on which organizations are compared and scored and reimbursed or penalized accordingly. I think there's been a little bit of a shift away from what one executive we talked to described as the warm and fuzzies, where it's really nice to update your waiting room and give everybody flat screen HD TVs, but there's no real way to measure the return on investment there, or particularly see how that's impacting patient outcomes. And so some of those things are important to look at, but I think there's a bigger and more measured emphasis on improvements tied to business objectives.
How are organizations using analytics to aggregate quality and patient experience data across various providers and see connections? How do you apply the learnings in an actionable way?
I think the thing that as with a lot of other analytics use cases within healthcare organizations, it's reporting that can be done in a way that leaders can first understand and then act upon. And I think one of the recommendations that came through was to offer suggestions about how to change things based on the information that's been collected. It could be something very simple example is, a number of patients in the odd numbered rooms in this wing are complaining about their rooms being too hot. Those happen to be the ones facing west. And so in the afternoon, it's going to get warm in there. So, don't put people in those rooms if they're going to be there in the afternoon. A very simple example, not directly related to care delivery, but it shows about actionable kinds of insights. And another thing, and this gets a little bit more sort of into an advanced use case, but is a little bit more about insight into what will happen if action isn't taken. If you don't take a step to try and improve upon this patient experience metric. If you know you're not able to incrementally improve the communication of nurse staff at discharge, and you don't hit those metrics for HCAHPS, this is what's going to happen. This is the amount of money you could lose in terms of reduced reimbursement or penalty, or this is what will happen to your overall hospital compare rating if you aren't hitting these metrics appropriately.
Once we can more accurately measure patient experience, how should we think about the ROI of investments in the patient experience space?
So for the executives that we interviewed, and this is something I've reiterated a couple of times, it's really about tying solutions or the use of solutions that measure patient experience. Whether it's a point of care survey or a survey that's sent out via SMS message or email a couple of days after discharge, to very specific goals with a very measurable outcome. And I think that's why a lot of attention is being paid to HCAHPS scores or star ratings, because there's a specific incremental improvements that can be made that allow for those increased reimbursements, increased scores, increased ratings, or the penalties for not hitting them. And so that's where you start to think about the ROI, is that if we're making this investment to understand the patient experience at the point of care, and we're able to move the needle a little bit, this is what's going to happen. This is the the additional reimbursement we're going to get, or this is what happens if we don't do it.
For our final question, how will providers gather the richness from open-ended feedback versus structured question sets?
This is actually a good question, because a number of the executives that we interviewed actually mentioned the value of open-ended responses, especially when it came down to addressing specific patients or specific care questions and scenarios, and not just in sort of the formal survey feedback mechanism, but also in the leave a comment card kind of situation. Products here that offer natural language processing capabilities can play a role. They can parse some of that feedback, look for keywords or phrases that warrant attention. Like I mentioned before, it's identifying specific problems that patients have brought up that can be addressed in that moment, or responding after a hospitalization. We see that you mentioned this particular challenge. We'd like to make sure that it has been resolved. And in these cases, it's helpful for providers to work with their vendors to decide on what keywords or phrases they want to look for, because as noted, different organizations are going to have different priorities for improving the patient experience. So one customer's needs may be different from another customer's needs, because they're focused on a different different business line, or they might be focused on different metrics to track. And so it's kind of an N=1 sort of scenario there, about trying to figure out with a vendor which what do we look for in these open-ended responses, and what will trigger a response in the moment, what will trigger a response retrospectively, and what will we do with that data, and how do we present that in a coherent report to show that progress has been made.
Thank you, Brian. With that, we are out of time. I apologize if we did not get to your question, but please feel free to email Brian afterwards. For more information about the point of care survey solutions and measuring patient experience generally, I encourage you to check out our report. It goes a bit deeper into what we covered today about the market, and also examines leading vendor solutions. Look out for our follow-up email tomorrow morning with the recording, Brian's email, and more information about the report. Thank you.
Thanks, everybody.